How's it going, everybody? Welcome to the stream. Probably gonna just be a short one, but I do think it'll be quite an interesting one to say the least. Needless to say, Dr. Knight has taken a few days off trying to recover from hours in the OR, many of which sadly I did not stream, but still a lot of good fun. Oh, chap, this is going to be a rather difficult one, brother. Too bad you're not here. And this will definitely be a challenging case for the OR. Had to prep myself in just a second for this one. It's going to be a tough one. And I do love good, powerful instrumental music. Let's see here. Now I gotta have something that would just break hearts. Ooh, there we go. This will be perfect. Sweetheart. Let's take a look and see what we have. Let's see here. Got several lacerations, abrasions. Notable swelling to the frontal aspects of the skull. Indicative of an increased intracranial pressure. Bleeding looks to be well controlled. I did a good job. Oof. That is a nasty deformed section, though. Looks like we're gonna have a pretty extensive date in the return. But that's okay. We'll see what we can get accomplished. Next to be some pitting edema around the abdomen, lower chest area. Let's go take a look and see what the cause is on that. I'll get you through this, one way or another. Oh, my good friend, Mr. Quantum. Welcome, brother, welcome. Welcome to a little sadness for this evening. The patient currently on the table is Dr. Shilan Knight, Shilan's wife. He doesn't have a lot of him, but we will see to what extent the injuries expand. And we must find out the cause of these injuries. Shilan has a suspicion, but he has no proof yet. Popcorn in the bed. All right, sweetheart. Let's see what we can get accomplished today. Hey, welcome to the stream. Appreciate that follow there. be swapped out here. And I'm going to go ahead and begin the recording. Trying to keep the music just enough y'all can hear it, but, you know, I'll wash my voice out later. We'll see how it turns out. There you go, Timo. Let's see what
I'm here, I'm ready.
Excellent. Let's see what we can get accomplished. I just got her IV changed out. Alright, Timo, I'm gonna get her sedated. The deformity to the skull is most concerning to me. Positioning would indicate possible damage to the rear aspect of the frontal lobe, depending on how far the intrusion is.
Mm-hmm.
We'll start with the head and we'll work down. Depending on what we find in there, she could be down for quite some time. Alright, let me get the etomidate and the succinylcholine on board. If you'll get a 6.5 ET tube, you can do the intubation.
6.5 ET2.
Yes, sir. I really wish I could still see the PED messages while I was in cinematic, because this too and that would be a just wonderful shot to do the whole surgery. Alright, team, our medications are on board.
Okay.
Sorry, music switch. I'm gonna play with your There we go. Lift up on the laryngoscope. Good. Right, down past the tubes.
Okay.
Hang on just a second.
Mm-hmm.
Timo, go ahead and put her on the ventilator. 100% oxygen. Yeah, 22 breaths per minute, and I'll be right back.
22 breaths?
22. I'm gonna hyperoxygenate the brain.
Hello, hello.
can I do for y'all?
Is the person in there, did he get brought in with some guys with a brown face mask and, you know, has multiple bullet wounds?
No, unfortunately, this is my
Oh.
wife.
Oh, I'm so sorry
Oh,
about
wife?
that. Okay, yeah, sorry. We'll leave you be
Alright.
then. I'm so sorry. Yep. No,
So,
yep.
nope.
Sorry, Mr. Knight.
Sorry, Dr.
Yep.
Knight.
No,
That's
you're
the
the
mission.
good
I
job,
wish
mate.
you the best of luck, happy health, and life and marriage. Sorry.
You
Good
might
luck,
try
wife.
the ICU.
Good luck, wife. And other person in there.
Second.
Yep.
Let me scrub back in. Got a PD for a good laugh. Wasn't that just wonderful? And you know, Knight's such a horse's ass when he talks. He sounds like he's pissed off at the world all the time. Just makes it that much more fun. I have to settle for a Coke right now. I didn't want to break into the beer just yet for the night. Absolutely recommend.
Okay, I've got it set up on the ventilator.
Excellent work. Gonna track the incision line directly along the hairline. Make it easy for her to hide it. You grab me an 11 blade, please, sir.
Yeah.
We'll start the craniotomy.
Here you go.
Thank you. All right. Let's begin the recording. It's August the 21st, about 17:10 hours. This is Dr. Shilan Knight in the hybrid operating room outside the medical center. I'm assisted this evening by Mr. Timo Dandelion. The patient this evening is my wife, Nizana Knight. She was transported into the emergency room here at Mount Zona by our paramedics. She was found unconscious and unresponsive near the casino. Patient did present aside the unconsciousness with multiple lacerations, an obvious broken arm, multiple abrasions, and deformity to the frontal aspects of the skull. Blood pressure maintained low but stable. Heart rate was elevated, indicative of an increased intracranial pressure. Wounds were attended as best they could in the emergency room, and she was transported to ICU for stabilization. For today's procedure, we'll be beginning with a craniotomy to truly assess the internal damage to the skull and to the brain. Making the incision. Tracking the incision along the ear, up around the forehead, covered up by the hairline. primary incision is complete. Alright. The top portions of the skull are now exposed. Quantum, I warned you I was going to pull your heartstrings on this one, brother. Alright, Timbo, will you hand me the bone saw? The fracturing there is horrible.
Oh.
And it's upwards towards the corner. I can work around that. I may have to cap it, but we'll see what the underside looks like. Alright. The frontal bone itself appears to be in decent condition down to the forehead area. Kernel structure has some minor fracturing near it, but I don't believe it'll be too bad. This left aspect, though, on the frontal side is the concerning bit. We'll start with a midline removal. I'll take it down the coronal suture and we'll go from there. Let's see here, what are we looking at? There we go. Take my wee prep up basin with some saline, please, sir.
Oh, what of saline?
Just a surgical basin of saline.
Ah, yeah.
Got a submerged bone when you take it out. Let's see here. See what we can get accomplished with this.
I have no idea who's calling me, but I'm not gonna pick it up now.
And actually, that reminds me, has anybody told Kiwi?
I'm sure Hank has. Hank did the whole ICU.
Okay.
use the full basin, whatever it's named.
Oh, thank you, sir. I just know Kiwi would be very upset with us if she didn't know.
He called me, so I assume he probably tried calling her as well. Just hope he texted.
There's a lot of splintering on the underside of the skull bone now. It would be easier to cap it than try to salvage this. I'd be more afraid of further injury down the road if something broke loose. I'll just do a titanium cap on it, but the fracture pattern there appears to be indicative of a blunt force trauma. Hammer, baseball bat, maybe something of that nature. It's pinpointed almost, so I would believe a smaller object. Timo moved. Alright. Yeah. Let's get in there and see what this swelling's doing. My ninja stack is already distended. Alright. Getting into the meningeal sac. Be ready with suction.
Okay.
Here we go.
I'm ready whenever you are.
Oh, there it is. Pull that section in close. Golly, look at that hematoma. Let's see if we can get this out of here. Here we go. Where is this still bleeding at? Timo, move that suction in closer for me.
Okay. Is that close enough?
There you go, hold it right there. I gotta get this hematoma cleared. Problem is, it's sitting towards the left. Just off the red line. So we're fixed to have one of the three possible problems. It is slightly forward, so I'm going to lean a little harder that it's going to be on the anterior cerebral artery or the branch of the anterior kidney artery. What are two worst case scenario? That bleeding originated from the internal carotid. It runs up through the neck into the brain and branches off into the cerebrals. I have a feeling when I move this hematoma out of the way, it might get very messy. Keep a closer eye on her vitals for me.
Did you say keep an eye on the vitals?
Yes, sir.
Okay.
Because if it is the artery, which It's the internal carotid.
Gonna keep glances over at the monitors.
Okay. If it's the internal carotid, Timo, I literally will have 2 minutes to stop the bleeding. I shall bleed out and hemorrhage faster than I can. Be ready.
I'm ready. Heart rate is 120, blood pressure 87 to 60. It was 86%.
Hematoma's out. Here comes the bleeding. Let me get to the gray matter here. Come on, where's the source? Shit. Timo, give me a pair of vascular clamps. It's the internal
keep grabbing them.
carotid.
Okay, here.
Alright, let's do this. Timo, start a timer.
Alright.
Clamping the artery.
The timer going. Looking over the clock.
Alright, I'm gonna suture it down first. We'll wrap it in surgical mesh and then we'll cauterize it. I'm gonna cover an area that'll be about a centimeter longer on either side to give it some reinforcement. Grab me a 3 centimeter wide piece of surgical mesh.
Okay, here.
Alright, there we go.
1 minute 20.
Is that counting down or adding up?
Down.
Whew, trying to kill me there, Timo. Ain't.
No. Down. Down from 2 minutes. 1 minute left.
Alright, grab the cauterizer.
You go.
Alright, wrapping. Alright, let me get this cauterized down.
Did you do it?
Alright, clamps off. What's the time?
Okay, 10 seconds were left.
Woo! There's a reason I'm not a damn neurosurgeon. Okay, let's see if it's starting to refill now. Wait to see, is it gonna refill? Come on. It's holding.
Perfect.
Alright. Remind me to give myself a dose of legacyrp after the surgery.
Understandable.
My blood pressure just spiked. Oh, she's just descending. Give her a 250 milligram dose of mannitol.
250 milligrams?
Yes, sir. We'll use the mannitol in a quick fashion to reduce the intracranial pressure.
That was 250 milligrams, correct?
That is correct.
Perfect.
Just give it slowly. It should take about a minute to get the whole syringe in. Alright, just clean this out here. Alright, that's the initial of the bleeding. Let's see what else is in head. This might be entertaining. She's gonna pull something. I just know she is. I can sense it. Okay. Looks like that's gonna complete the debridement. Let me move over just a little bit here. I'm gonna make Timo sweat some bullets. Cause it'll be fun, why not? Timo, you see that little bit of bleeding right above
You
where
see that there?
the ear would be on the left side there. Yeah, I don't have a good angle on it.
Yes. Are we looking for this here?
Yeah,
Okay, what am I supposed to do?
and it's just like a firearm. Point at the bleeder and press the button. And it'll give
Okay.
one quick discharge. It'll cauterize the bleeder. You may have to, depending on the size, do it a couple of times, but no pressure, Timo, but that is near the limbic lobe, so to be cautious.
Okay. Okay, so one quick discharge on the cauterizer on the bleeder.
It'll burn
Okay.
the blood cells away, but it'll expose lower so you can see.
Okay. I'm gonna line it. Okay. Right. 1, 2, 3. Quick. Okay.
Alright, looks like you still got a little more bleeding in there. Can you see the source of it now?
Look.
It may just be some small capillary beds. Okay, by your left hand, see that little river of blood coming right there? Just tap that with the cauterizer. Just a single quick discharge, just like you did. See if we can find this.
1, 2, 3. Shot.
There you go. Oh, I don't think I've ever told told you this, Timo, but that surgical cautery tool, when you tap the button, it heats up to, about 300 Celsius.
What?
That gets nasty hot. Don't ever touch the end.
Oh god, yeah. That's a good warning. Thank you.
You know, perhaps we should leave a few of those lying around and we'll play by the rule of survival of the fittest.
Like a kid touching the stove.
Natural selection, baby.
I mean, you only do it once and then you learn to never do that again.
Yeah, but you basically laser off whatever you touched. Okay.
300 degrees, yeah.
Okay, let's see how we're looking here. Let's see if that took care of that bleeding. Alright, I think we got it. Well, I guess we can count that as one more step closer to Dr. Dandelion.
One day.
Oh, don't worry, Timo. Your day of torment in medical school is coming.
I'm excited, and I hope you're prepared for me to ask a million questions.
Put it this way, Timo. By the time that I finish your training, you will be able to step into this OR and give someone the fighting chance to survive some of the most gravest of injuries. But we'll have to see. Alright, would you grab me a number 3 half skull cap?
A half skull cap?
Yes, instead of a full cap, it's just the front half of one.
Are they over here somewhere?
Unless Nancy's moved them, it should be in the bottom right-hand drawer over there. But you know how Nancy likes to move things. Golly, some of these are so loud. There we go. I love the music for dramatic effect, but seriously.
One.
Excellent. Go ahead and pop it out and rinse it down with some saline for me.
Look at every spot.
Prep this bone, we'll place in an ICP probe and then we will cap it off.
Oh, we're putting one of those ICP thingies here?
Yeah, I'm gonna tuck it down to the side so we can remove it without having to open it back up again.
I kind of remember this from the other surgery we did. Not fully, but the term.
Well, do you remember what the appropriate ICP for an adult patient is?
Oh, that's a good question. I don't think I do, no.
So acceptable is between 20 and 30 milligrams of mercury.
20 and 30?
Hmm. Most of your patients will generally be 22 to 26 is where you'll find most people at in just a normal operating function.
Okay.
Alright, the probe is in place. Let's see here. Alright, hand me that skull cap, please, sir.
Mm-hmm.
Alright, let's get this into position. There we go. Alright, good old brace and screws. Here we go. You know, and I have a really good bad doctor joke ready for her when she wakes up.
Oh, what joke are you gonna tell her?
I'm gonna tell her I went poking around in her head. Can't even hide in there. Here you go, Timo. Secure that side.
Secure it.
Very carefully, because you know if you don't get it perfect, she's gonna give you hell about it later.
Yeah.
There would be no doubt about that one. If anything messes up, I'm just gonna tell her you
Alright.
did it. I think she would believe me.
That I did this?
Mm-hmm. I'm just gonna tell her I was talking to you on the phone and walked you through it.
Oh my god. I think she would be highly impressed, but also be like, huh?
Alright, I think we're good here. You're good over there.
Mm-hmm.
Alright, wires in position. We'll shut that drill down over there and we'll get the skin pulled back up.
You want me to put the drill away, correct?
Yes, you can just set it on the tray
Okay.
over there. No need to put it away. That's what we got Nancy for.
Mm-hmm.
And Nancy constantly stays on my shit list, so I'm gonna leave a wonderful mess for her to clean up.
I mean, at least so far she puts the things back where they belong, so...
just help me get that side up over here.
Want me to assist with the cap?
Oh, we already got it secured. We just gotta get the skin back around. Just make sure it doesn't catch on the back side of it.
Good so far on this.
Excellent. Alright, Timo, go ahead and roll the forehead skin back up for me. Damn, Jesus, that's a lot of gunshots. Oh, sound like you're whispering there, Timo.
Oh, sorry. I was talking to myself.
Oh, you're good.
I sometimes do that. I'm sorry.
Alright, let me get this suture going. And we are also going to have to place a rod into that right ulna. It's a nasty little fracture. We'll do a 2 incision on it. It can be realigned. It's actually sitting pretty close to where it needs to be, but I want to make sure that it stabilizes completely. Oh, who knows what other surprises she might toss my way. We'll just have to see. But you know, I do have to say, it's quite fitting that Knight is the one doing the surgery. Such a stone cold asshole. Because to him it doesn't matter who the patient is on the table.
Anything I should grab yet from the drawers for the arm?
If you want to go ahead and pull an orthopedic tray, I'll finish off this suturing. And we'll get started on that arm. You go ahead and cut that cast off too. But
Hello.
hello.
Just thought I'd come say hello, Dad. Bye, Dad.
Be careful, Hank. Hank,
Ah,
since you're here, give me the quick rundown of what you found.
on her?
Where was she at when y'all found her?
Casino underground parking lot?
Okay. I saw in the notes she was unconscious, unresponsive.
Yeah.
Yeah.
So you had the visible deformity to the skull and the obvious fracture of the right lower arm. Who called?
I don't know. Damo said when he got there, there was no one there.
Yeah, I still have the number. I saved it. PD wasn't here yet or anything. I didn't know what was fully going on. Later, Alex told me that there was like a letter or something.
There's 2 notes I can show you.
Yeah, I have the phone number still. I saved it since Alex told me. So I still have the number and what they sent me.
Hold on, let me grab the notes and I'll drop them in.
All right, there we go. Head is closed up. All right. Now, if you just want to cut that cast off, we'll put a new one on after we get it all fixed. I'm gonna change gloves real quick. So y'all be honest, do you like the very sad instrumental music in the background? Timo, how the battle's looking over there?
Heart rate 117, blood pressure 87 to 58, and O2 is at 88.
Excellent.
Heart rate is dropping and blood pressure seems to be rising.
Well, that's a good thing if we're coming down from 117.
Was it like 130 or something for the heart rate?
Hey Dad, can you come here quick?
Yeah, give me 1 sec. Alright, let's see what you got here. Well, damn.
We're looking for you now too, so
Let them
watch your back
come.
and all that.
They can either decide to come have a conversation, or I'll resort to some other means to find them myself.
Yeah, Alex is doing the same thing for some reason. Thor's come after me once and he doesn't want it to happen again, so he has resorted to putting on fully blacked out clothing.
Well, change up what you wear, change up the car you drive, and keep a gun on you at all times.
I'm not sweating it too much. I'll just run to the airport, pull out an Avenger and fly away.
We'll find them one way or another.
Someday.
Right. I'll go get your mom's arm fixed, and then I'll move her back down to ICU.
Alright. I gotta fly out now. But
Alright.
I'll check up on her in the morning.
Alright, I'll shoot you a text and let you know.
I bet.
You'll
Catch
see,
you, Ben.
eh? Alright, we all set over here?
Yep, cast is gone. I've got the tray ready as well.
Yeah, I do think y'all might find this a little exciting. You're going to see a very dark side of the good doctor. Many people know, but not everyone knows. Shilan was in the army.
Yeah, vitals are looking okay so far.
Excellent. He was in the army, but granted, yes, he did. Served primarily in the medical corps. Timo, you ready to do this?
Mhm.
But there was also some dark aspects of his military service, especially in his younger days before he was a doctor. Alright, you can go and step right on this side too, Timo. Hold on the radius to where we can work on them. We're going to drill into each end. We're going to take a titanium rod. We're going to feed it down through the ulna. Once we get it all the way through, we'll pin it down, put everything back in place, and then we will close it up. And we'll put a clean cast back on here.
So it's basically 2 horizontal kind of like cuts that we're doing.
And that's why I'm making the
Okay.
marks, so you'll know exactly where to cut. Alright, Tima. So watch this. This is a 10-blade scalpel. It's got a rounded tip on it. So, you're going to cut through the dermis into the epidermal layer. And then as you're cutting through the epidermal layer, you see that little bit of yellow subcutaneous tissue right there?
Yeah.
That is what you're looking for. You know, when you see that subcutaneous tissue, you need to slow down because you're almost to the muscles and the tendons.
Okay. Is the yellow stuff like, is that the fat?
And there's fat tissues normally.
Okay. And basically down to there and then stop.
Because what we'll do is we'll move that out of the way with forceps. In this particular case, especially back here on the elbow, because of the tendons and ligaments that I don't want to damage. And same thing on the wrist. So I will work on exposing this. Follow the line that I drew you.
Okay, and I'm only going down to the fat layer.
Yes, that offset yellow color.
Okay.
Remember, that is razor sharp, so please don't take your fingers off. See how quickly it glides through the epidermal layer. It's like a hot knife through butter.
Alright. Am I ready to go?
There you go. Alright, set your scalpel down. Alright, nice and easy there.
That one? You mean that one?
Right there.
Perfect.
Now just finish getting to the edge of that line I drew you. You've got a good working field. Alright, let me drill this
Right,
one.
there we go.
Use those and you're just going to move through the
I'm pulling away muscle tissue here, right?
not muscle, just the subcutaneous tissue. Just the yellow.
Oh, okay.
Good, just like that. Up to about a ½ centimeter. Right there. Okay, clear that little area and that'll expose exactly where you need. Excellent work. Alright. Yeah, here you go.
Okay.
So, you're going to make a borehole into the bone, so you gotta get to the marrow. You're going to go in at a 14-degree angle.
For about how deep? When do I know that I'm at the bone marrow?
So here's the fun part about bones. Once you get to the solid part, it pops.
Okay.
But you're going in about 1.25 centimeters.
A centimeter and a quarter?
So yeah, about 1.25 centimeters total.
Okay. Okay, so kind of like at this angle?
There you go. Alright, now the trick to that drill. Don't drill slow. Spin it up fast because it cuts through the bone much easier and causes less damage.
Okay, so like a quick move forward
Spin it up
and then back.
and press it in.
Like a quick in and out.
It'll take about 3
Okay.
seconds in total. There you go.
Okay, okay.
Alright, well that was going all over the
Alright, and
stream.
then back out.
Gotta watch instead of hanging out in the
That's
observatory.
enough.
Alright, go ahead and back it out and look at the end of the drill. Alright, so you see the kind of chunky white yellow mix with that blood right there on the end of it?
Mm-hmm.
That's bone marrow.
Ah, okay.
So you are perfect. You're in the center portion of the bone.
Perfect.
Alright, let me feed this rod in. Alright, let me get this in. Okay, there's the fracture site right here. Alright, Timo, push down on her arm.
About here?
Yep, there it is. I had to get it to pop back into place. There we go. Alright, you should start seeing it on your end.
Oh, there it is. Yep, I can see it.
Excellent. Alright, so let me know when we've got about 3 centimeters sticking out. That.
Yeah, there we go.
All
This should
right.
be about 3 centimeters.
Pinned. I'll pull it back up. We'll pin this top side. Okay. So you see the grooves on the side of that titanium rod?
Mm-hmm.
So if you take that pin and you lean down just a little bit and look into it, you'll see that there's pre-drilled holes for those.
Yeah.
Alright, go ahead and set the pins. Now these are a little different than what most people think of with a pin. There's the pair of very oddly shaped pliers that's on the. So you'll actually catch both ends of that pin once you've slid it through, and you're going to crimp it so it creates a standpipe that will not allow it to go back through the bone. Does that make sense?
It does, yeah.
A little old school, but it works very well. Hey, Joker, what's going on, brother? Yes, it is Mrs. Dr. Knight. There you go. Right. Now I'm just going to peek at the vitals, make sure everything's looking good. Oh, the That's much better.
Is this enough crimping?
Yep, that's good. Once it clicks, you know you're good.
Yeah.
It's a little internal safety mechanism that will prevent you from crimping the pin to the point it would fracture.
I heard the
It's just
like snapping or whatever you said.
it's a very soft. Just
Yeah.
it's all that it is. Oh, I do understand that one, my friend. This way there may be a very dark side of Dr. Wright. Come back to the surface. Alright, you got them both set?
Mm-hmm.
Alright, let me seat them up. There we go. You hand me that pair of bolt cutters.
Bolt cutters?
That's literally what they are. It's a sterilized pair of bolt cutters.
Okay.
But they have titanium tips on them, so it's lighter, and it's the only thing that'll cut through this titanium rod.
Oh yeah. I mean, yeah.
Oh, don't worry. I'm sure Mr. Jerry will probably eventually find himself in fun situations with Dr. Knight.
I did find the bolt cutters on the list, but I did
Alright, Timo.
when I
clip
prepared
it.
the tray. Alright.
You're in place.
Right. Back.
Good job.
Thank you. I made myself a little rhyme to hopefully remember the ICP thing.
Oh, don't worry, Timo. Once you get to the actual medical school portions and you start dealing with it on a very regular basis, it will be dedicated to memory.
I did actually at one point when I had to learn, and that was like years ago, when I had to learn the bones of the body, I turned it into a song.
So
I know that happened in like some TV show or whatever, but I did actually turn it into a song and like it helped.
So now I just want to know, what is this song?
Oh, I don't remember it unfortunately. I wrote it down on like a piece of paper back then, and used it like with a couple friends to remember it during a test. But that was like 5 years ago at least. I don't think I have that piece of paper anymore, unfortunately. I'll have to do another new one. I remember usually trying stuff like that with covers of songs and then just changing the lyrics.
You know, Timo, I do now fully expect that in medical school you will be performing this song.
I'm gonna try my best to write a new song just for learning the bones.
Excellent. I will make sure that your classmates will be expecting your assistance.
Oh, you can bet I'm gonna make Justin and Leah and such learn that song as well. I'm just gonna keep singing it every time. I'm gonna try and do my best to keep it stuck in everyone's ear.
So we're gonna have us a nice little trio to sing.
Hell yeah.
Alright, let me get this lower suit up.
Mhm.
Now the nice aspect of doing a dual incision surgery. Yes, there's 2 incisions, but they're much smaller, much easier to clean up and suture.
Mm-hmm.
Plus, it reduces the area that any possible infections could set into. All right. Timo, would you be so kind and grab one of those black air casts out of the cabinet against the wall over there? Should be in the far left one, if I remember correctly.
Okay.
Maybe the fourth shelf. White box has got kind of a purple logo on it.
Wait, you mean this one?
Yeah, it should be down on the bottom there.
Okay.
It's a purple and orange logo, if I remember correctly.
Yeah, it is actually purple and orange.
Some new concrete shoes. Oh, yes, it may get very interesting. But it wouldn't be concrete shoes.
Yeah, here, found it.
A couple of 100 concrete boxes, maybe, but yeah, we'll see how it plays out. Put it this way, if you ever want to hide a body, don't piss off a surgeon. There we go. Yeah, because if you ever piss off a surgeon, you'll be finding pieces of them for decades. You know what is going to be the hard part of that one, dear, is keeping Timo out of the loop. But Knight wouldn't want to expose him to the horrible facts of his past. Alright, that should work nicely. Alright, Timo, go ahead and slide that air cast on. And that should do it. We'll keep her intubated for a few hours just to let her body rest.
Okay. Yep.
Awesome. If you don't mind, would you take her back to her room? I need to think about something for just a second.
Oh, yeah.
Okay. That dang monitor getting me stuck.
I went to the switcher in 3.
I'll be down in just a moment. Yeah, give me 1 second. All right, sorry about that, yeah. Oh, let's see here. Excellent.
Dr. Knight.
Alright, brother. Just got done in the OR. Let me check on my patient real quick, and I'll be right with you.
Yes, sir.
Give it just one shake.
Got her hooked up to the...
Excellent. Still looking good on vitals.
Take a quick peek. Right, heart rate 107, blood pressure 90 to 59, and O2 is at 88%, so
She's still low on O2 levels. Let's go ahead and bump her up to 24 breaths a minute on the ventilator. We'll keep her on 100% oxygen for now.
okay, so 100% and 24 breaths a minute.
Yes, sir. Give her a little extra just to help support the body for now. But I will get her surgical report done here shortly. And just because of the circumstances, no information released and no visitors other than immediate family. You are Kiwi for now.
I think the emergency contacts from Hank's report also listed like immediate people. I think us, you, Hank, myself, Kiwi, and I think someone else was on there.
Let me check real quick. I didn't look through all of it. I just read the incident. Edward.
No, probably Edward Valen. I haven't seen him around in a while.
That name's not ringing a bell to me. I'll ask David about it. But yeah, we'll keep it to just those until we get some more figured out here. So,
Do you want to limit the discharge to one of us so we can make sure that we can contact PD?
yes.
Okay. Just thought I might ask so you could maybe put it in the surgical report as well with the discharge orders.
I will definitely take care of that for you, sir. Right, well, we'll keep her intubated for at least a few hours. Nancy can extubate her if she's doing better.
Mm-hmm.
But I gotta go take care of a couple of things, and then I'll reach out to those other patients and see where they're at in regards to getting surgery done. All right, you gonna stay up for a little while, brother? You fixing to go sleep?
I'll probably go and pass out. It's not an easy situation.
I understand.
Pretty energy draining. That was a pretty good surgery though. I think I learned quite a lot again.
That's good. I guess Timo, I won't be around forever. Somebody has to
I'd
be
pop
able
into-
to fill my shoes. Okay.
I will. You take your rest later as well, alright?
I won't be too far behind you. Now that she's at least stable and out of surgery, it'll be alright. see you later, Timo.
Have a good one, Shilan. Wait. We're really blessed to have you.
I appreciate it, brother.
If you need anything, I'm here. All right?
I will give you a call. If I can't get a hold of you, I'll call Jerry.
All right.
Okay? Go get some sleep.
Will do. If Jerry comes around, give him greetings for me,
Swift kicking the
and
ass.
tell him
I got you.
I'm all right. And tell him I'm all right. He doesn't need to worry about me.
I will take care of it for you.
Thank you. I'll see you around.
I'll see you tomorrow.
My mom, just to kind of get you fully in the loop, he's got a sister
Okay.
named Alice, and I was able to make the connection and learn that Alice has a code name that she likes to go by, which is Zero.
Let's
And I know-
let's run up to the roof.
Yep.
Just in case anybody wakes up, because I gotta show you something.
Yeah. Alright.
At least up there we can talk in private. Don't have to worry about pride.
I'm been looking for this guy. He likes to show up, cause a little bit of havoc, and then disappear. He texted me today, because 5 days ago I texted him and I said, "Where you at, bitch?" And he texted me and asked me, said, "Why are you a little butt hurt?" And said, "Big talk from a pussy that likes to hide." Homeboy likes to hurt women. Won't touch a guy at all. Stays away from guys. That right there tells me he's a fucking bitch. And I do know that yesterday, your wife had texted me and said that that there was an issue, and she said that she had been taken by Zero, and apparently she was knocked out, and there was a note left in her pocket. And so I went by y'all's place because I can tell you the note that she had yesterday pretty much said that you were not safe either.
Take a look.
Oh. Okay, yes, this first one is the same one that I saw yesterday.
Okay.
The second one, nope, that is brand new to me. Now see, I had a conversation with Hank the other day, and I tried to warn him, and I don't know him very well, but he pretty much gave the impression of, "Oh, I'm not worried about it. I'll be alright." Which, I mean, obviously, these people, they know what the fuck they're doing.
Yes.
They're smart. I've searched through all public records that I can. I've talked to PD, I've talked to FIB. They don't even know who these people are. And doing it to the guy was outside, cops that were there, FIB was there. They walked right past him. Nobody even knew a thing. So he knows how to blend in well, which is what's terrifying.
The 13th, when Snazana and me got back from the wedding.
Do you know who that is?
Ah, it's Henry.
Oh, okay.
He comes and stands up here.
Okay, I was about to say.
Yeah, sometimes we do have that happen, but it's all good. But the day we got back from the wedding, him to the hospital. As we were walking out, he popped up in the elevator and then immediately went back down. He wanted to talk to Snezana alone, and I wouldn't let him. He didn't much like being told no. But he finally conceded. So, he was wearing black. He was wearing a skin-tight mask. And that mask let his green hair show through.
So he's still wearing the same shit.
Yes.
As, that picture that he sent me. So that's. See, that's where it concerns me even more, is because.
Damn, I hope he was wearing a parachute. I think he just jumped off the hospital. To any units downstairs in the hospital.
Yeah. He's laying face first on the ground.
Yeah, I don't think I have anybody downstairs right now. I'll probably have to go get him myself. I will say this though, David. If you find this bastard, do save a piece for me.
Oh, absolutely.
I don't
Absolutely.
know what his issue is, but he's already hurt 2 people that I've known and that I cared greatly about. And I'll be damned if he's going to get a chance to do it again.
Well, and I know when he said you weren't safe also, I have no worry about you. I know you can handle yourself.
Oh,
You just-
and I always keep proper tools handy.
Oh, I believe it. I mean, I know you're ex-military. I know you're not going to let somebody sneak up on you and just manhandle you.
Always watching and always have means of egress. That is the most important thing.
Well, I can promise you this. He's going to get caught. And I'm going to make sure it's not by FIB, it's not by police. Because I want to get my hands on him. And I know there's a lot of people that do. And trust me, I'm going to leave enough for you.
David, I can promise you this. If you do get your hands on him, once he has learned the error of his ways, I can make sure that he will be in several thousand pieces that will never be found.
I fucking love that.
And if you want to, just happen to lose the body and it be found somewhere, then I'll do a standard autopsy and sign off the cause of death, and then he just goes away to the morgue. But I still think it would be a lot more enjoyable to put him in a few thousand pieces that'll never be found.
Yeah, I mean, I think for a while people will be uncomfortable not knowing if he's still out there and watching, but at least we can give the people that we care about the most the satisfaction of knowing he's not coming back.
I would like nothing more than knowing that he's in so many pieces that they will never find him. But
Well, we can make that happen.
I kept telling him, son, it's not a good day to die today.